Hi Zoe. I am so excited to have this conversation with you. We obviously met through a mutual client who we worked with, who went on to have a really brilliant birth. Yeah, she was really pleased about that. And yeah, I guess this conversation, I wanted to be around like for people who are pregnant and watching this and thinking, do I need a physio? Kind of like, what does a physio do? And hopefully by the end of this chat, they will have an answer.
Yeah.
So to start off with, Zoe, welcome. And what got you into this work?
So um, originally I was just a musculoskeletal physio, but I had a few ladies I was working with post-injury, who were having then got pregnant during like our rehab, like kind of end stages. And was like, oh, can I just like continue with you through my pregnancy and afterwards? And I was like, and at the time I'd worked with a women's health physio in my previous job. And I was like, I can give you some basic kind of advice, but actually, I'm probably not the best person to work with at the time. And I'd had a few of these. I was like, do you know what? Actually, this is a good time to kind of do the training in women's health, especially around kind of pre and post pregnancy and during. Um, and it's been like amazing because a lot of people I've worked with, especially women, and I think like all of us, we meet someone, we're like, oh, I like them, we connect, and actually to have to start that relationship all over again, you're like with something that is quite intimate, and when you're going through kind of rehab from an injury, you do share like your fears and your most vulnerable. And so to do that again with someone new. And so I thought, yeah, let's do the training, which is when I went over to Women's Health, but also did my kind of prolapse training and the incontinence side. So it's quite nice to have the whole package together again, so that it's a one-stop shop. But also what's quite nice is then I can, once they go the further into the postpartum and they want to get back to certain activities, I can then support them doing that because of my musculoskeletal background.
Brilliant. I love that, like, you're able to provide that continuity of care, which is something that so many women don't have, especially from the NHS if they're working within that system. Um, so yeah, that must be quite good to be able to see the progress and also the changes that the woman's body is going through as well, as opposed to maybe somebody seeing you right at the end when there is a problem or, like something related to postpartum. So at what stage of pregnancy would you normally start working with women?
So it depends on the person and how kind of worried they are. So it could be before the pregnancy, just discussing like what they can continue doing during the pregnancy, or they might have some lower back or hip issues, and it's like, okay, let's kind of address these before we start increasing the weight going through those areas. We might do that. Or it might be around 3 months when the body is going to start changing a lot more. And so we can prepare them for those changes. And then when you go into third trimester where the baby's like to suddenly grow, you're in a really strong position. But also, obviously, as the hormones change, your body changes. And so you kind of, with pregnant ladies, you're kind of looking at them as like my hypermobility patients, where everything's getting very loose. And then what happens is the ligaments get loose,
Yeah.
but the muscles then tighten. So they just feel stiff all the time because they haven't got that strength to control that movement that the ligaments are giving a bit more. So what we can go through is some strengthening exercises to help with managing that. But also some gentle mobility work rather than static stretching, some mobility work so that they maintain that flexibility. So at the birthing part, they can get into that position that's most comfortable for them. They're not restricted because they're so stiff. But the other things we can like talk through and like there be other specialities, but I'll be able to point them in the right direction is like their eating and their gut health. Also, the swelling, we can do some soft tissue stuff to kind of help things moving, especially if they get really swollen. But again, also some advice about how to manage that themselves.
Brilliant. I love that it's like so holistic. It's not just looking at the physical health, because you can't separate the physical, emotional, mental, and all of the things that are happening in pregnancy, where you hear so many women saying, "Oh, I've got carpal tunnel," or like, sciatica, all these physical issues that come up as well. Are there any things that people can also do alongside seeing you that can help themselves? So, say, for example, if somebody's thinking, okay, last pregnancy, I was prone to nerve pain or sciatica or their hips were sore, or it's maybe even their first pregnancy, in order to like help with the changes that their bodies are going through, are there also some things that they can do alongside physio?
Yeah, so absolutely fine to work with a trainer that either has experience with pregnancy, or I can like obviously help support them. And so that's what I'm also happy to support the other people you're working with. Um, Pilates and yoga, again, people that are experienced in pregnancy. Um, but also kind of it's about how your body feels as well. So sometimes with these people, they're like, oh, we can't do this at this point. You're like, well, actually, there's a lot more now because a lot more research is being done into women rather than everything done on men and then applied to women. This is like that is very unique to women. And so it's had to have funding put into it to do research. And what we find is actually you can do a lot more for a lot longer. The other thing is if you've had something before in a previous pregnancy, it's then making sure you have this. So if you've had like pubic symphysis
Yeah.
problems, it's like, okay, last time at the end of my pregnancy, I needed to have crutches. It's going to be something that's temporarily, but it just means you can stay mobile. And so it is, or it might be a belt just to support around that area and give you some more stability. Um, but with the exercises as well, doing them alongside, it might not be as bad. Or I had a lady where it was just as bad, but actually, because we'd done some work together that she hadn't done in the first pregnancy, she contacted me and she was like, I've had the baby and the pain's gone. And it was like before she had like a month or so afterwards of like this continued pain, because also, if you're going to breastfeed, the hormones are going to continue to be released.
Yes.
And so you're still going to have that laxity in your body. So she was like super happy that actually all the stuff we've done before, even though we will manage the pain. Actually, post-pregnancy, she was in a much better position than she was from the first pregnancy. So that's the other thing. It's like with pregnancy, we're as women health physios, we can't solve everything. Some things are like, do you know what? We're just going to have to manage this, but I can
Yes.
promise you afterwards, it's going to be gone. It's not going to carry on. Like you were saying about carpal tunnel, it's kind of like, okay, we're going to have to wear supports around the wrist, but once the pregnancy's over and everything, your body starts moving back to what's normal for you. Those things are going to disappear. It's not a long-term condition that you're going to then have to have more treatment or even with carpal tunnel surgery to
Yeah.
deal with it. It is going to disappear. So
Yeah.
that's the other thing, is that support to be like, this is okay, this is normal. I'm there's only so much we can do to support you, but it is going to go.
Yeah, brilliant. And sometimes just having a professional who's seen other people going through that, saying, okay, this is normal. And also, I like what you said, because sometimes it's giving birth is the like ultimate cure, because of all the hormones that are there, but also that managing the symptoms during pregnancy makes a huge difference. I often say to women, like, how the pregnancy is going to impact on the labor impacts on the birth, and the birth impacts on the postpartum, so you want to try and be as comfortable as possible. So say like practical things that somebody wanted to implement in their home, is there anything that you would recommend? Because you hear so many people, and I know we can't do like one size fits all because every body is so individual, and even the same body through different pregnancies can change. But are there things like maybe like some gym balls and at bath salts or anything like that that somebody could be going, do you know what, I'm watching this right now. I'm experiencing a bit of discomfort. Um, Practically, just things that aren't going to make the situation worse, but w will hopefully help the symptoms.
Yeah. So actually having um yeah, something that supports. So if it's like side lying, if your legs kind of come together, it's like, oh, this is a lot of pain on the front of my pelvis. Having a bolster that you can put between your legs just to open up and relieve some of those symptoms. Um, but also in sitting and probably in lying as well, trying to avoid, because of the weight of the baby, it's going to pull you forward into what we call like an anterior tilt.
Yeah.
And so it puts lots of pressure on the pubic symphysis, but also it shortens the muscles in our lower back. So we're like, got pain at the front, we've got pain at the back. So also having something that you feel comfortable, like a chair that's, and there isn't the perfect chair, even for anybody, but having something where you feel you can allow your pelvis to rock backward and that your trunk is supported. So it might be if you're struggling with laying on your side and you're normally a back sleeper, it might be that you have like a wedge in the bed that you can still lay on your back, but you're not, like, especially in the last trimester, you're not going to have complications.
Yeah.
So things like that. And also, yeah, obviously making sure the bath isn't too warm because it can induce labor. But yeah, if you are achy and feeling stiff, yeah, absolutely fine to go for a bath, as long as it's not above 30 degrees.
Yeah, exactly. Because then the temperature in the womb is, I think, is it a couple of degrees higher? So yeah, you don't
Yeah.
want to
Yeah,
do
and
that.
like homeopathically, it's like what's the things that make you like the smells that make you relax? Put those in the bath so that your body can. And then do obviously with the especially further on to the pregnancy, your diaphragm, everything like pushed up into your chest and get yourself into that open position, like a position that's really comfortable that you can kind of relax into it. And then doing some like deep breathing through the nose and out through the mouth, and not worrying so much about it going down or you breathing into your tummy. Actually, even just getting your lungs to expand is really good and can kind of release some of that kind of neurological tension that you might be having if you are worried, or you have a problem and it's you're just like holding yourself, trying to think of a way to deal with the pain.
Yeah, brilliant. And I guess even something as simple as walking as well, movement, when you were talking about like the muscles kind of like tensing up, I was thinking like sometimes when muscles do that, our inclination is to go, okay, I'm going to freeze, but actually maybe some movement and building in like into your day, even like say a 30-minute walk as well. I guess that could be something that's beneficial.
Yeah, no, definitely. And it's just making sure that that you have a shoe that's supportive. Obviously, as you get heavier because of the pregnancy, it is going to put more stress on the feet. So you might want to go from a shoe that you would normally wear if it's quite flexible and thin to something that's slightly more supportive, that's got a thicker sole and kind of goes around the feet, just so you can continue doing that.
Yeah, that's such a good point because it's not something that people consider necessarily when they're thinking of like, oh, okay, I might need like some new clothes because, my bump is getting bigger, but, our feet that hold us up every single day, it's like they're also taking quite a lot of that pressure. So maybe using things like that, and thinking about like the body like as a whole as well, even things like probably changing your bra size as well, you know? Yeah, brilliant. I love that. And maybe things like swimming as well. So many pregnant women love swimming, and that like just taking the pressure, I guess, off the feet
Yeah.
as well makes a huge difference.
Yeah, and you can use floats and things to kind of support around kind of the waist. So you can put it underneath the bump and it's just going to keep you up. So you're not kind of, again, kind of sinking down into that low, kind of anterior tilt.
Yes, yes, exactly. That makes so much sense. And that thing as well of like people working in jobs that require them to be like, quite like sitting down all the time, just being mindful of maybe taking breaks as well and just moving the body.
Yeah,
Um, yeah.
definitely.
Yeah. Okay, brilliant. Earlier on in the conversation, you mentioned a couple of conditions. So just wanted to talk about like things that may come up. I know we've covered things like carpal tunnel and pubis symphysis, but what about also other things like you mentioned incontinence? How common is it? What can women do? How can you help women to prevent, or if women are already experiencing this condition, what can be done postnatally as well?
So what's recommended is to have, as they call it, a mummy MOT after the pregnancy. So it's typically around 6 to 8 weeks after the pregnancy, where either lots of people go to their GP, and yet from my experience of people going to their GP, they're not properly assessed. It's kind of like a tick boxing exercise.
Or even if they assessed at all, the number of
Yeah.
times I hear women saying, "Oh, they just asked me, do you feel okay?" And it's like, how are you supposed to know? So I always say to people, make sure you get physically checked. Sorry.
Yeah.
Yeah.
No,
And you continue.
it's like the GP doesn't like does it, but it's like doesn't feel as comfortable as a women's health physio or a gynecologist to be actually doing this. So they're not really 100% sure unless they feel a specialist interest in it, really sure what they're meant to be checking. And also, I think also the fear of like saying the wrong thing when people are going back to like, oh, when you feel like it. So yeah, I normally would see, so either I would say if I was working with someone and they're like, actually I'm working with a gynecologist, I'm like, look, either me or the gynecologist to do like a 6 to 8 week check. I would do like an internal investigation, like yeah, investigation. And basically that is us feeling around um the cervix and just seeing is has anything changed.
Yeah.
And because obviously you could have a prolapse that is a grade 1 that you wouldn't even know about.
Yeah.
Um, and so it's just where the wall has come down a bit. And so you can't even see it, but it's from that internal you would know. And it's, I always say to my ladies that have got a grade 1, I'm like, it's nothing to worry about. We can manage this as long as we keep your pelvic floor strong and making sure we're not putting any additional stress onto that area. It won't get any worse. And there's also on the research, there's no research to show that if you have a grade 1 prolapse and then you have another baby, that it will definitely get worse. So that's another thing to be really reassured about. So we would do that. We'd also look at how from the internal, and again, if you don't feel comfortable, it's not something that you have to have an internal. We can do a lot of testing from the outside and feeling how the perineum is moving and whether, and also your abdomen, how that's moving to determine how well you're engaging your pelvic floor. Because I think that's the other thing. And definitely don't go to it if you're still feeling quite sore around that area because it will give false kind of negatives because it's just uncomfortable. But that's typically around the time that we would normally see people. Yeah, and then we would look at how your pelvic floor is engaging. I would be able to test that internally and, as I said, externally. And then giving you a tailored program for your pelvic floor. If there is some weakness, is it on the slow kind of contraction and hold, or is it on the fast, quick, and relax contraction? Is it that you can engage really well and the muscle's strong, but actually it's that relaxed stage of things that you're struggling with? And that will tell us a lot if you have incontinence. Is it because there's a weakness? Or is it because you're constantly engaging, but actually, when you need to engage to stop that sensation of needing to go, you actually have nothing else to engage because it's already there.
Mm.
And so we will then tailor, like I said, is it a strengthening thing, or is it okay? We're going to do the pelvic floor, but actually, the bit we I want you to concentrate on is the complete relax, and then practicing that in practice. So when you go need to go to, you feel the urge, you need to go to the toilet, you can engage the pelvic floor, and then when that urge disappears, you'll then go, okay, now you're going to relax it, because then next time the urge comes, because the bladder's got a little bit fuller, we can hold again.
Yeah.
Um, but obviously, the only time we would change, maybe see you slightly earlier is if for some reason you had to have a catheter after the birth. We'd probably want to see you a bit earlier to get your pelvic floor engaging, because sometimes with catheters, it can change how, like, the automatic way that your bladder fills and empties, and it's been used to emptying continuously to going, oh, we're taking it out, and now you've got to let, like, fill up
Yeah.
fully and be back to normal. And so that's the thing with incontinence. And then later on, normally around 3 months pregnancy, if someone wanted to go back to a sporting activity, I would then, and I like to do it with someone. So if it's running, I would go for the first run with them, and we would do like interval, like slow interval running. And see, and as we're going through, I'm constantly going, how's your pelvic floor feeling? Are you feeling heavy? Do you feel like you want to wet yourself?
Yeah.
So that we know, firstly, how much the pelvic floor endurance it has to run, because it is a constant pushing on the pelvic floor
Yeah.
when you land. And going, okay, you can run for 10 minutes before you feel heavy. That is all you can do. And then we'll work out a plan to steadily you get back to whatever distance you want to do. Or it could be every time I land, I can feel I release. So the first one that I was talking about is more of a um the one I'm talking about with the running is stress incontinence, because it's the stress of
Okay.
suddenly, and then the other one is an urgency incontinence, where it's whenever you feel like you need to go, you feel like you can't hold it, and
Yeah.
it's not normal activity. And so again, we would tailor it in two different ways. It might be like pelvic floor is great, you're no incontinence, like urgency incontinence, but actually when we start doing the gym, going back to like your classes, going running, and even with cycling, you'd be like, every time I hit a bump, I just like leak. And so then we would be like, okay, we need to work on that.
Okay.
Yeah,
Brilliant. I love that. And I guess what you were saying about that importance of the MOT postnatally, I can imagine it's so much more beneficial if you're doing the investigation, but you've maybe done a check on that woman antenatally as well to be able to see the difference, because I imagine postnatally, you're like, okay, how do I know what is normal? Um,
yeah,
and I think as well for women, like when you were describing the urgency incontinence, I was thinking it's so much in our nature to think of other people's needs. And some women, you hear them postnatally saying, oh, yeah, I needed to pee like 3 hours ago. And they've like forgotten that. And I guess it's something that can also um, get worse, even if it's maybe not a problem initially. So it's worth investing in something like that. Yeah, that's really interesting thinking of that. And some women may be going through it, but then are so fearful of sharing it with somebody and think, okay, if I'm seeing my GP for, a very short appointment, like, is it going to make a difference? Can I confide in them? And like, it must be so different talking to somebody where you're running alongside them as
yeah.
opposed to you sat across the table and they're looking at a screen as well. I remember when we met in person, you just done a run with a client, and I thought, oh, that's so brilliant. I can imagine that's so much more than somebody describing, like, oh, yeah, it was a good run or I managed it, like you actually experiencing that with them allows them to be able to open up more.
And also they can think about like sometimes with like Zotchi running, it's a thing to switch off from the world. So it's like, okay, just on this run, we're going to be like really aware of how we're feeling for this one. So that they don't miss it. Because obviously if you do miss it, you then can cause more problems by just like pushing through.
Yeah.
And that's a really kind of sad thing. The other thing I was going to say about the kind of postnatal checkup is also where look at your diastasis. Is it coming back together? And actually, the other thing for people to know is if they are struggling with like moving about and they feel really disconnected with their trunk and they're just like, I'm just really struggling to roll over in bed, get up, and I'm having like, I'm really heavy on my arms, but even that, I just like feel like I'm engaging too much in my abdomen and I'm really worried it's going to cause the diastasis to come, recti to come further apart. Absolutely fine from giving birth to do some abdominal exercises.
Mm.
It's doing the right ones to encourage the muscle to come together rather than kind of that pushing out. And
Yeah.
that's something that we can help with afterwards. It might be, I saw a lady recently, I think 6 days after giving birth. And I was seeing her for something else, and she was like, "Oh, actually, this is flared up." And then while I was there, she's like, "Oh, Zoe, could you look at this as well? Because I'm really struggling." So we went through some abdominal exercises that were very gentle. Um, and literally, she said, like, within a week of doing them, she was like, she just felt a lot more connected with her body and just able to move and be able to do the thing that mothers want to do, like support their baby. They're not like, and like both parents are typically quite tired or whoever's supporting you to like then like poke them or like, hey, can you come in and like, or can you wake up and like pass me the baby so I can breastfeed? It doesn't like help with both people being up. So
Yes.
being able to be independent and be like, I can do this bit because I feel more connected. So yeah, typically the traditional thing was that you can't do any abdominal exercises until 8 weeks post-op. But actually, if you're doing the right ones and in the right way, you can start a little bit, you can start earlier. And then we can build on that to challenge the abdominal muscles a bit more to back to where they need to be to do the activities you want to do outside of even being a mother.
Brilliant. Yeah, I really like that you've added that because also I can imagine, it's not about going on the internet and finding, oh, which exercises are safe. It's again that personalized um care because you could be thinking you're helping the situation, but actually you're doing more damage to the situation. And also it might also, I guess, I wonder, this is a question for you, like, does it also depend on like maybe the type of labor and birth that somebody has had, because I imagine maybe somebody might need some more sessions, say if they've had an instrumental delivery. Is there anything around that as well that people should be kind of looking out for and seeking physio? Are there any like particular conditions where you go, okay, do you know what, in this situation, it's really advisable to see a physio regardless, even if you need like maybe a one-off session, it could be beneficial in those situations. Are there any kind of particular types of births that people need to be mindful of with physio?
I think if you've had a C-section, there's so much information given to you afterwards. It's a lot to take on. So
Yes.
sometimes having a one-off session with a physio just to go through the things like about supportive moving, also with the scar, going through, okay, from this number of weeks, this is what I want you to do for the scar to help with that healing. And also you are going to, the thing always people are like, oh, I need to break down the scar tissue. Scar tissue isn't the enemy all the time. Scar tissue is absolutely normal and it needs to be happen, otherwise your scar won't heal. But excessive scar tissue isn't good. So if you have too much scar tissue, it then can attach, if you've had a C-section, it can attach to the abdominal wall
Mm.
and the fascia, and then you can feel really restricted, and then it can cause some kind of pelvic pain or back pain because you're not being able to move as easily. So that's why it's really important once the wound is healed to start doing some soft tissue massage on it to help. it to stretch because typically surgeons will sew it quite tightly because they want to make sure it's really knitted in place and it's not. And also with your abdominals, because you're going to move, they don't want it to like be pulled apart. So we need to make sure that area is quite supple, which is why after 2 weeks, typically we start doing some stuff around the area. And then I normally would leave it an extra week if you've got more likely if you have just stitches that have to be removed or staples that have to be removed. I would then leave it a week after those have been taken out just to make sure it is knitted into place before you then go over the scar. If it's dissolvable stitches, or a glue, again, it's also doctor dependent what they will use. You can start at 2 weeks because the dissolvable stitches, they're not going to like suddenly at 2 weeks just go, I've gone. They will slowly dissolve. So you've still got some support around the wound.
Yeah.
Um, so that's probably C-section. Instrumental, I think if you have any discomfort, around the pelvic area, like lower back, front, underneath, it might be worth just seeing a physio and having it checked out to see if there's anything. Again, if you have a tear and you've got some stitches,
Yeah, or an episiotomy as well, I guess.
yeah, um, it yeah, it might be worth physio again, just having a check. Is everything, and the doctor will check, but is it healing? Going through, and again, it's just another area that's going to have a scar like you did prior to the birth with massaging your perineum. Again, exactly the same, massaging around the scar site to give the best outcome for the flexibility in the tissues.
Brilliant. And I think as well, like, we're both living in London and it's known for being such a busy city. And sometimes women have this thing of like, oh, I need to like, I don't, is the phrase bounce back post-birth,
Yeah,
rather than accepting also the importance of rest during that time, just really resting the body can also aid that recovery. Movement is great before birth, or even if, some people, it's hard to stay in the house for
yeah,
40 days, for example, so a walk might be good, but when we say have a walk, maybe it's not a 2 hour walk every single day because that's going to push the recovery back as
yeah.
well.
And also, it's really important with the activity you're doing, to not push it too much because you're recovering. Don't think I need to bounce, like you say, bounce back straight away. Like give yourself, it's like recovering from surgery. Just think it's like a traumatic, even though it's a beautiful thing, it's also a very traumatic thing for the body and it needs a year to fully recover. And I normally say, like it with surgery, at 6 months, you'll be 80% better or 80 back to where you want to be. It's going to take another 6 months to get that last 20%. And there's no point pushing it, especially if you're breastfeeding, even more, because actually, if you push your body too much, you're not going to produce the milk that you need to give the baby because you'll be dehydrated. So, the other things to think about is if you haven't got a bottle, get like a big one of these big reusable bottle that you can constantly fill up. But also, if it is a hot day, thinking about your electrolytes to make sure that you are not only going to kind of use fluid to move, but also you're going to sweat it out.
Yes.
And also, eating well is so important for you and the baby. Um, with some of the research we've done on women with eating, it's like really important before you exercise to have some protein. And then also afterwards. So if you have something to eat, you've got a window. It's still quite a big window. It's like a window of like 2 hours before for you to work out. But it even could be just be going for a walk with the baby. Make sure you have something to eat because actually, as women, we're very inflammatory. So if we don't eat, we then produce these inflammation in the body that can cause more musculoskeletal problems or even just irritate your gut. And it's kind of like our panic mode. So yeah, really important to be regularly eating and making you're recovering. So making sure you have and you're giving away to the baby, making sure we have those proteins and the fats to help the body have energy and rejuvenate and produce the milk that the baby needs.
Brilliant. I love that you mentioned the water bottle. I am like the postnatal police with water. Whenever I see a woman feeding her baby, I'm like, you need to also be drinking, you know? And it's great with the water bottles with the straw because it means you're lying down, you've got the water bottle there, it's not going to spill over, and just encouraging yourself, reminding yourself as well, like, oh yeah, I need to drink, you know? So say if a woman is ideally in bed, the water bottle's there with her. When she then gradually moves to a stage where she's like, okay, now I've kind of done the being in bed for maybe a few days. You know, some people do the like 5 days in bed, 5 days on the bed, 5 days next to the bed, and then gravitating to other areas of the room. Some people don't have that luxury because they've got other siblings and they're living in houses where there's stairs, so they need to go up and down. So even just placing that water bottle in different areas of the house,
Yeah.
having a feeding station maybe near the sofa where they've got that out of baby is sleeping as well and they're not maybe feeling like, oh, I can sleep as well. Maybe that could be a good time to try and do stretches or even wearing baby and going for a walk whilst baby is
Yeah.
sleeping as well, you know, and just wearing baby in a sling that also supports the back as well. I wanted to just briefly touch on like with breastfeeding because we've mentioned it a couple of times, and I guess any kind of feeding as well, just like that act of holding a baby
Yeah.
daily, several times a day, and that can do to our physiology, you know, and our backs. And so, what are some of the maybe things you come across as well that are related not just to the birth, but also feeding? Because I guess these are things that can also affect, you know, mom's primary caregiver, and her if she's, you know, doing the looking after the baby the most and the majority of feeding.
Yeah. So with breastfeeding, I think there's this been preconception that you need to be like constantly watching the baby and like you shouldn't move because once they've latched on like you just have to stay there because they're like let go or something. But
Yeah,
actually, to start with, it is going to be like trial and error about how the baby latches on. But once they're there, then think about like, okay, I'm gonna have to stay here for a long time.
yeah,
I have to hold myself here. And like the chair was designed to support you, and so use it. So I always say, like, once it's latched on, as long as you keep the arms there, lean back into the chair and make sure, like, head as well, if it can be, but at least shoulders and the back. There should be no gap between you and the chair
yeah,
or sofa, wherever you decide to, or even bed, like, have like pillows and things set up that you can then relax back into it. Um, a lot of people say like having the pillows underneath is difficult. But if it's something that's good, you can put pillows underneath the arms, but making sure they're high enough that so when you do come back, your arms are still supported. And it doesn't make you go, oh, I just want to go back to that position because my arm aches. But actually, if your trunk is well supported, your arms are not having to hold you and the baby. And you can rest your arms onto yourself once
yeah,
the baby is in position.
exactly. Yeah.
And I find that people that don't do that have like neck issues, shoulder issues, and then it's just like absolute agony to try and maintain the breastfeeding. And it
Yeah.
becomes quite stressful for both you and the baby to be doing that, especially it's going to be multiple times a day.
Yeah. Exactly. And also sometimes then what people end up being in a situation is where they anticipate the pain of being in that position. So then they freeze more. And when you're not relaxed in the feed, the baby is going to feel that so much.
Yeah.
This postnatal visit I did with a client who had a baby recently, she had the breastfeeding pillow there and she was struggling with the latch. And I was like, okay, let's work on the latch again. We know that baby can feed really well because I saw
Yeah.
him feeding brilliantly at the hospital. And the reliance on that pillow and that like going forward,
Yeah.
you know, and I was just saying, I am going to take this pillow away and I need to us to work on that. And then maybe afterwards you can use the pillow. But I always say to people, like, it's going to cost you so much money doing this every single day and then needing to fix your back years down the line. So
Yeah.
like even being mindful of that like laid back breastfeeding, and being comfortable, not using too the gadgets can help later on, but being comfortable enough to so they don't end up being a crutch and you can feed your
Yeah.
baby wherever you are.
No, definitely. And I think it's a bad myth that about sitting that you should be bolt upright and you should be able to hold yourself. If you lean back, you're slouching. But actually, if you take a picture of someone, especially even like the ladies breastfeeding, you're like, does this look like you're slouching? They're like, oh no, my back's actually quite straight. And they just like sometimes it is having a actual photograph to show them or in the mirror that actually they aren't slouching, they then feel more comfortable to go into that position. And like if the baby's happy with that position, they're happy with that position. Yeah, it's just much nicer and just one less problem to have to deal with.
Yeah, brilliant. I love that. And it's so great, like, because we can't see ourselves, how somebody outside of our bodies can see us. So that's such a great um way of showing people like, okay, this is so important so that you can be comfortable and getting the right sling as well to wear your baby. So to make sure that it's safe and supportive for you and realizing that maybe your partner might need a different one to the kind of
Yeah.
sleep that you need as well.
Yeah. And that's the thing with seeing someone before and seeing what posture they're in. You can then be like, okay, when the baby, as you get bigger, and also when you use a sling, these are the things I need you to think about. Because again, it's like that pulling forward
Yes.
and then they compensate. So we're like, it's okay to lean, even in standing, like put your weight on the back of your feet and the baby kind of being, you're not gonna suffocate it. The head's to the side, they can breathe. And yeah, it is reassuring them of all the things that they're worried about, that actually it's fine. But and if they don't do things, move in kind of a normal way, that they then will end up overloading certain structures and they will get tired and they will get unhappy. And then they're then very end up being themselves very restricted in what they can do, which can be really frustrating. And also quite depressing for them, especially if, like we say, like getting out and getting fresh air and getting moving is really a good mood thing. If you're just stuck indoors with the baby in a certain position because that's the only one that's comfortable, it's really will affect people's like mental health.
Yeah, absolutely. And it's all so interconnected. One thing we mentioned earlier on was diastasis, and I'm aware that maybe somebody listening to this might be like, what is that? Might have it and not even know that they have it. So do you mind just explaining what that is and how somebody could maybe identify if they do have it themselves to then go, okay, I need some professional help in actually diagnosing and treating this?
So it's what they call mummy's tummy, and it's basically something that's naturally happens in the third trimester. So as the baby grows, the muscles in the abdomen start to separate, to make space for the baby, and then after the pregnancy, they should come back together. And so that's when we have to be really careful when they are separated that we're not doing abdominal exercises that cause the contents to be pushed out through that gap. And again, afterwards, until it's come back together, again, we're going to be avoiding exercises that push. So when you do like a sit up and your tummy extends, it means that you're pushing your abdominal contents into your abdominal muscles. So the things to look out, especially after like at 8 weeks, there'll still be a slight gap. But if you get to 3 months and it's still a significant gap and you've got like a bulge coming out, that's when I'd be concerned that the muscles aren't coming back together. It's nothing to worry about. I saw someone 2 years post pregnancy who still had that gap. And we were able to work on it. And within a couple of months of her working on it, she was able to get back in her bikini. and feel just as fantastic about herself as she did after the first pregnancy. So the thing to be aware of is like not rush back to classes because it's especially exercise classes, probably not so much Pilates and yoga, but it's more your HIIT classes, where you're not controlling your movement and you might not have that strength in your abdomen to keep everything pulled together when you're doing certain things. So it kind of pushes it apart, especially if it's not come back together. But yeah, that's what a diastasis recti is.
Thank you. And also, somebody might be listening to that or be thinking, oh, well, I had my baby like 10 years ago. Can I still get some support? Or maybe like their mom also recognizes that issue within them. And I always say to people, you are forever postpartum. It's not like, oh, okay, it stops
Yeah.
after a year. So, is there like an expiry date to somebody being able to look at these issues and go, okay, look, I need something to be corrected?
Yeah. I've actually just worked with two ladies, both one is in their 70s, one's in her 80s. And she just said, oh, I've got this pooch. Um, that's like I hate so much, and it just seems to be getting worse. And actually, with working with both of them, doing a similar thing that I would do post-pregnancy, and they're of a generation where like kind of postpartum care was just didn't exist. And we've been working on it, and they've both dropped two dress sizes once we've like increased because they don't need that room for that kind of expansion of their abdomen. And also because the muscles have come back together, it's more supportive of their abdominal content. So for them, it was like more vain reasons. But yeah, there is no cutoff to
Yeah.
um, if we do, I work with a plastic surgeon, and sometimes I will work with their clients for 3 months. And if they're diligent with their exercises and we don't see any improvement, it's just there might be other things going on. That's when you may need some surgical intervention to kind of bring the fascia back into where it could be that there's a tear in the fascia. So the fascia needs to be brought back to where it should be to support everything underneath. So the fascia is like the skin of the muscle is the best way to describe it. And if
That's a
that's
good description.
damaged, it needs to be like sewn back into place so that everything has something to kind of keep it where it should be. And so I've seen a couple of people like that. Typically, people that have twins, it's it seems to be more prevalent in. But you'd want to give it time and do go down kind of the exercise and physio route first before going into the surgery. Because actually, if we can get it even a bit better and we get to the point where like it's been 3 months and actually or even like 3 months, you're like, oh, I can see improvement. And then another 3 months, you're like, actually, it's not got any better.
Mm.
Then you're like very conscious of it. Then yeah, but also the other thing that with having it, you'd want to do it once you've finished all pregnancies. You wouldn't just so you've got them all out of the way, have the surgery, and you know that's it, that's the end of it.
Okay, yeah, that makes sense. Okay, fantastic. Thank you so, 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 so much. We have shared so many tips in this conversation, so I'm sure it will be beneficial for so many people. And just to go back to your services, do you also offer home visits? Because I'm aware, like, if somebody's had a baby and we're like, okay, you need maybe a chiro for baby, and you need to do this. Is that part of the service as well? If somebody's like, I want to give myself the best chance to recover. I'm going to do it how my great, great, great grandparents did it and just
Uh,
absolutely rest and have food brought to me and recover as much as possible. There's something they can maybe also write into their postpartum plan, to go, okay, I'm going to book a visit at home. Is that something that you do offer?
yeah, that is. I do home visit, and then um yeah, and I will cycle over to your place. And then obviously, if it's something where, say, you wanted to go out to the gym, we could then do a session in my clinic because I have a full kitted gym as well. And again, yeah, and if it's like going for a run, actually we can do it from your home. And the with the running or any exercise, I normally maximum of like half an hour, and then look from that, then be like, okay, let's also look at some exercises to support that. But yeah, home visits, absolutely.
Fantastic. Thank you so, so, so much. I'll make sure to write some of the tips that we've spoke about throughout the conversation and also details of your practice, physio motion, and your contact details as well on the screen. So thank
Brilliant.
you so much.
I thank you for asking me.
Yeah, brilliant.